Yeah.
Okay. Hi everyone. Good evening. Thank you for being here. So we are from group one. We are going to share with you guys about the importance of hand hygiene. Okay, I'm going to start with some introduction. Okay, next slide. So these are our group members. All right, thank you. And then next one. So here are some introduction to hand hygiene. We all know hand hygiene is important ever since the COVID-19 hit us. Because during this discussion or this sharing, um, my friends will share with you about the importance, what are the steps of hand hygiene. Okay, next one. According to the CDC, doing hand hygiene can prevent many infections, especially in the healthcare setting. But like not everyone will have the opportunity to wash their hand because not everyone has the access to clean water, good sanitation. Okay. Next one, the definition of hand hygiene. Shafira, or maybe anyone can just read.
Yeah, Shaira is here. Okay, let me introduce introduction of the definition of hand hygiene. Hand hygiene is washing hand with the plain soap water. Next, antiseptic hand wash will be washing the hand with the water and the soap or
Buena. Shahira
sorry.
already.
That's why. That's why.
Shahira here. So continue, Shahira.
Okay. Boleh continue?
Shaira is there already, but she's difficulty in
Oh,
suara.
Can we continue?
we
Okay, I just
continue.
Okay.
Mm-mm.
so on behalf Shaira, right? Okay, definition of hand hygiene. So hand hygiene is washing hand with the plain soap and water. Antiseptic hand wash, washing the hands with the water and the soap or other detergents containing an antiseptic agents. Other than that, alcohol-based hand rub. It is rubbing hands and with an alcohol containing preparations. Okay, the last one is the surgical hand hygiene or antisepsis. Hand washing or using an alcohol-based hand rub before operations by surgical personnel. So benefits of hand hygiene will be preventions of infectious disease, act as protections, improve health status, increase the productivity, promotes hand hygiene awareness, and also cost effective. So the moments of a hand hygiene will be we should do a hand hygiene, hand washing before eating, after using the toilet, after coughing or sneezing, after handling animals, after touching surface in public places, when caring for a sick person, after changing diapers, before and after applying the first aid, and also will be when hands are visibly dirty.
Okay,
So
good.
next person.
Yeah, next.
Okay, for cut ethic. So we when causing sneezing, we cover the nose and mouth with a tissue and then dispose the tissue afterwards. After coughing and sneezing, wash your hand with soap and water, and then wear the mask all the time if you have coughing or sneezing. Next.
So these are the video that for the hand washing technique. You all can have a look on the technique.
All right, so we move on for next slide. Okay, so how to use the alcohol-based hand rub. So here is a quick video.
So the duration of the entire procedure is 20 to 30 seconds. The notes: alcohol-based hand hygiene is the best method at killing bacteria. So if we don't have time to wash hands, we can just use any hand sanitizer.
Okay. The hand hygiene is a role in preventing disease spread. So next. Okay, hand hygiene. Hand is the most common vesicle of the transmission of organism. So hand hygiene has been recognized as the most important way to prevent the transmission of infectious agents. So the key one is patients in healthcare setting are at risk of getting infection while receiving treatment for other conditions. So cleaning our hand can prevent the spread of germs, including those resistant to antibiotics, and protect healthcare personnel, also patients. Patients and their loved ones can play a role in asking them, reminding healthcare personnel to clean their hands. So this one, the picture one, the place which we miss after hand washing, normal hand washing, not the WHO recommended. So the red one, the place we miss frequently, and the blue one is sometimes we miss, and then the usually we clean well at the white one. So the next. So this one common place where the organisms are hidden from the plants, animals, also from the uh, sponge, mold, yeast. Next. So factors: poor hands with hand hygiene. Hand washing agents cause irritation and dryness. Sinks are inconveniently located or lack of sink. Lack of soap and paper towel also. Too busy or insufficient time for the hand washing. Understaffing or overcrowding. Patient needs to take priority and the low risk of acquiring infection from patient. Next. So, how can hand hygiene prevent the spread of disease? When washing hand could effectively prevent the spread of infection. Hand can spread germ, example, harmful pathogenic microorganism by touching another person. One can catch germ by touching a contaminated object or surface, or subsequently touching their mouth, eyes, and nose. Could be saved by, from catching the disease by washing hand properly with soap and water. Inappropriate hand hygiene significantly harms children around the world. According to a report, around 1.8 million children across the world under the age of 5 years die due to the diarrheal disease and pneumonia. So microbes, example, Salmonella, E. coli, and norovirus cause diarrhea, respiratory infection, and hand-foot-mouth disease. These germs are often present in feces and can contaminate in individual hand during changing a diapers or using the toilet. It can also reach one hand while handling raw meat containing traces of animal, etc. So additionally, germs can get into our hand just by touching a contaminated object. So unknowingly, this germ can spread from one person to another with a mere touch or a handshake and make a person ill. So importance of hand hygiene and disease prevention. Germs enter the body via the nose, eye, and mouth. Then every person tend to touch their face multiple times without even realizing it. Germ from unwashed hand might contaminate food and drink and could be transferred to objects like handrail, tabletops, or toy easily. Washing hand with soap remove germ from hand, which lead to reduction in the rate of respiratory infection, eye and skin elements, and the decrease the occurrences of diarrhea. So proper hand hygiene has played an important role in preventing the further spread of severe acute respiratory syndrome such as SARS and the causal agent of ongoing coronavirus, so pandemic. This virus has been characterized to be extremely contagious and therefore frequent washing of hands with soap and water or the use of alcohol-based hand sanitizer have been recommended to curb further transmission of the infection. So,
Next question.
wash them those germ away. So from the remote control, tablet, pencil, cell phone, desktop, computer mouse, also school books, school bags, also where what touch everything we touch, we need to wash our hand because from there have a bacteria and everywhere. So next. So efficiency of hand hygiene. So good one, use a plain soap. The better one is use antimicrobial soap. The best one is alcohol-based solution like sanitizer. Next. So hand hygiene. To reduce hospital-associated infection, hand hygiene is not optional. Every healthcare worker should master hand hygiene. Hand hygiene should be used diligently to improve patient safety. Next.
Okay, in the healthcare settings, why do we need to do proper hand hygiene? Because patients are at risk of getting infectious while receiving treatments for other conditions. And then we need to prevent the spread of germs, including those that are resistant to antibiotics, and protects healthcare personnel and patients too. Therefore, everyone play a role by reminding each other, whether it's a healthcare personnel, visitors, caregiver, or patient. Next. This one is the five. This one are the 5 moments of hand hygiene in healthcare setting. First, before touching a patient. Second, before clean or aseptic procedure. Third, after body fluid exposure risk like vomiting or urine. Fourth, after touching a patient, and the fifth one is after touching patient surroundings. Okay.
Okay, now next we move to the strengths of hand hygiene. So at the first, that's a proven of efficacy. It is the simplest and most effective way to prevent the spread of infectious disease. So the second will be the broad protection. It is effective against a wide range of pathogens such as bacteria, fungi, viruses. Thus, it reduces the needs of the antibiotics. Third will be the accessibility. It is easily practiced with the soap and water or alcohol-based sanitizers. The fourth will be the cost effective. It is the most affordable and also the simplest way to prevent the illness. And the fifth will be the reduces the hospital stays. Okay, next. So we're looking into the weakness of hand hygiene. So at first is non-compliance. So many people who do not follow their hand hygiene technique or frequently, it can causes the spread of the infections. So second will be the dependency on others for hygiene. So those who are relying on others, for example, children and adults, elderly people who are relying on others, they might delay in receiving in a proper hand washing or hand sanitizing. So by that, it more infections to the other people. Fitness will be the increased exposure. So, for example, schools and daycare, they put in grounds for infections due to the frequently they will contact with the objects, surfaces, and sharing the objects. And the what will be the limited resources in some areas, for example, the crowded areas, rural areas, or playgrounds. There will be lack in the hand washing area and hand sanitizing area. So the fifth will be cognitive and physical barriers to proper and hygiene. So, for example, elderly patients and patients those who are having arthritis, there's a barrier in following the proper and hygiene.
All right, here we are going to talking about the different ages of the group in hand hygiene practice. So first of all, so we are going to talk about the infant and the toddlers, which is 0 to 3 years old. So they require guidance and also supervision from the caregiver to practice hand hygiene as they often explore with their hands and are prone to infections. So next will be preschoolers. So their average range will be 4 to 6 years old. So they begins learning proper hand washing techniques, but still need to reminders and also monitoring for effective practice. So the third one will be school aging children, which is 7 to 12 years old. So they're able to follow hand hygiene independently, but may need to reinforce again and again on when and why is important, especially before they're eating and after they're playing. So as a community nurses, they also will have a program in the school so that the child also can follow with the proper guidance. So next will be adolescents, which is 13 to 18 years old. Typically understand the importance of the hygiene but may neglect is due to lifestyle or peer influence. Education and on the preventions of illness is important. Okay. Next will be adults. So the average range will be 19 to 64 years old. So these generations will be expected to practice hand hygiene regularly, especially in food handling, caregiving, and also healthcare setting to prevent the spread of infections. Okay, then last one is old aging peoples. Old aging peoples also they know how to handle how to know the they also know how to do the hand washing, but because of the aging process, so they will forget. Sometimes the patient also will be ill, so they won't carry the hand hygiene. So next slides. So next person.
Global Hand
Okay.
Washing Day will be October 15, which is established in 2008 by Global Hand Washing Partnership, aims to promote the importance of hand washing with the soap. Otherwise, we encourage behavior change and emphasize the role of hand washing in disease prevention. Next. So, WHO initiative, this emphasizing hand hygiene in its effort to prevent healthcare associated infection, which is we do campaign Save Life, Clean Your Hands, and also our target is a healthcare workers. Clean Hands campaign. Hold on. Clean Hands campaign for disease control and prevention offers guideline, public service announcement, and material for school, healthcare setting, and general public to promote proper hand washing behavior. And then this is the type of water sanitation hygiene wash program. The aim is improving water sanitation and hygiene condition worldwide. Hand washing promotion is a key component, especially in schools, communities, especially in low-income countries, to make sure all of us is being protected. So numerous private sectors such as Protector, Gamble, Lifebuoy and Unilever collaborate with the government. For example, all those Lifebuoy campaign to help a child reach 5 to improve hand washing practice in countries with the high child mortality rates. So that's all from our group.
Do we still have time for the Kahoot?
Showing here is 10 minutes.
Do you want to try?
Yeah.
Maybe yes.
Okay, let's go.
Who's going to share?
If cannot, then tak apalah kan.
Manisha?
Nanti. Mm-mm.
Eh,
Yvonne should share.
Yvonne.
Ah,
Morgana, can you stop sharing?
alright. Hold on ya.
Sharing. Nampak tak?
Yeah.
Okay, nampak?
Sekejap sekejap.
Make it bigger.
Wait. Boleh nampak?
Nampak browser Kahoot je.
Yes.
Dia punya QR code tu tak ada.
Tu.
Tak nampak macam yang mula-mula tadi?
Betul.
Yang QR tu.
Ni boleh?
Still cannot.
Tak ada.
Yeah, can.
Dah masuk ke? Dah?
Yeah,
Okay.
can go.
Dah. Ada 7 orang kan? 8. So ada 12 orang ni.
Dia tulis you're in je.
Ya.
Yeah.
Okay. Okay.
Okay, start. Ada lagi ke?
I rasa tu je kot.
Okay, come, we start.
Okay, boleh start ah?
Yeah.
Boleh. Oh, satu je. Salah tekan. Okay.
Okay, next.
Okay.
Next.
Bye bye.
Okay. Good job, guys. Okay. Ah, salah. Alright. Oh, ya ada lagi. Okay. Woi, siapa nombor satu?
Siapa tu?
Mesti
Hebat lah.
internet laju ni.
Good job, good job.
Congratulations.
Okay, guys.
Okay.
I think that is all, kan? Kita
Yeah.
ambil gambar boleh ke?
Boleh, boleh.
Boleh. Jom.
Okay.
Everyone please on the camera.
Tak ada
Okay.
ni pun kena satu-satu Memang tak ada dia tak macam semua like compile macam tu.